Welcome to Northside 101, where Northside experts explain complex medical terms and procedures. Today's expert, Dr. Jeff Marshall.
Hello and welcome. My name is Jeff Marshall. I'm a cardiologist at Northside Hospital, and I'd like to welcome you to Northside 101. Today we're going to talk about heart health. Almost everybody in America that's an adult has some form of heart disease. We don't currently know which one of those patients will go on to develop serious problems. So the most important fact about heart disease is that it's preventable.
What are the most common types of heart disease?
It turns out that the most common form of heart disease is actually a disease of the blood vessels that feed the heart muscle. Everybody's heard of hardening of the arteries, and that's what most heart disease is. There are other types of heart disease as well. The heart is a big pump and it has 4 valves in it. And sometimes those valves either leak or get blocked. Those would be the 2 most common kinds of heart disease.
What are early symptoms of heart disease?
So some of the most early signs of having heart disease are actually a discomfort that occurs on your body between your belly button and your nose, often described as a pressure or a tightness sensation. Some people describe it as pain, but most people describe it as pressure. It often has a tendency to get up in your neck or go down your left arm. And it can be associated with nausea or vomiting or severe sweating. Some people will even pass out. The danger signs of heart disease would really be chest pain that comes on at rest. So a pressure sensation that gets in your neck or your jaw, goes down your arms, causes you to sweat, and does not go away. If you have that type of pain that lasts more than 10 or 15 minutes, you should call 911.
Who is most at risk for developing heart disease?
People that smoke cigarettes, people that eat high-fat diets, people that don't exercise, people with high cholesterol or diabetes or high blood pressure are at the highest risks of developing heart disease. Some of those risk factors you can modify by changing your lifestyle. Other things you cannot modify because you may have inherited it from your parents.
What is the impact of heart disease among women?
The #1 cause of death in women in the United States of America is heart disease. In fact, the next 7 causes of all deaths don't add up to the deaths that are caused by heart disease. But there are some unique risk factors for women and heart disease. One of them that has been recently discovered is that if you have preeclampsia or high blood pressure associated with a pregnancy as a young woman, that will put you at increased risk of developing heart disease when you get older. Likewise, when you get older and have the change of life or menopause, as your estrogen levels go down, women are at increased risk then for heart disease. Women actually get symptoms of heart disease a little differently than men. Oftentimes they won't have oppressive chest pain or pressure, but they'll just get tired or short of breath when they exert themselves.
Can heart disease be reversed?
While we can't actually completely cure heart disease, there are lifestyle changes and medications that your doctor can prescribe that can reduce the chance of having serious heart disease. We never make it really go away, but we can reduce the chances that a patient with heart disease will have a heart attack. I'm Jeff Marshall from Northside Hospital, and thanks for watching Northside 101. If you have any questions, please leave them in the comments. And remember, be safe and stay informed.